friends, to another episode of Get Health with Dr. Cooper. And I'm very happy to be with you today. Last week we discussed prostate cancer, and this week we're going to be discussing another cancer of the male genitalia, that is testicular cancer. But before we go on to our discussion today, I'm very excited to share the good news with you that next Sunday I will be in Miami. I will be at the Miami International Book Fair for my first book signing. There is the flyer on the screen. I will be there at Miami-Dade College. Miami-Dade College. I will be there on Sunday for the book signing from 11 a.m. to noon. But I'll be there from Thursday, Friday, Saturday, Sunday. So all my Facebook friends, if you really have not bought my book, 14 Days to Amazing Health, this is a fantastic book. Get your copy and pass by the book signing for an autograph. I will be there on Sunday, 11 to noon at the Miami-Dade College. And you can see this flyer on Facebook, so just look for it and find me. It will be a pleasure to talk about my book and see you there. Actually, I'll have all 3 books there. So don't forget, if you're living in the Miami area, find me there on Sunday, the 19th, 11 to 12. So let's talk a little bit about testicular cancer. You know, last week, one of the viewers, she asked a question. She found it very unusual for a female doctor to be discussing male problem. But as I explained to her, many male patients like to open up to discuss their problems with their female doctors. And most importantly, the message needs to get out. If we as physicians can empower our patients, then many of these diseases we will be able to prevent or reverse, because we're empowering the patient to take charge of their health. Now, testicular cancer, it's not very common. 1 in 260 men in the United States are diagnosed each year with the cancer, and 8,850 new cases are diagnosed yearly. And not many men will die from this cancer. It is believed that 1 in 5,000 men will die from testicular cancer. However, if this program is able to save 1 life, then I would say it's successful. So even though it's a very rare cancer, the information needs to get out for men to be empowered to take charge of their health. However, over the last several years, the incidence of testicular cancer is gradually increasing, 28% over the last few years. And what are the reasons for this increase in testicular cancer? Well, it is believed that lifestyle and environmental factors are the reason for the increase incidence of testicular cancer. And if you listen to my show, you know that I like to talk about lifestyle, because we can tweak our genes, we can suppress diseases, we can reverse diseases depending on the type of life we live. How do we eat? How do we sleep? How do we control our stresses? All these are important factors to either prevent or retard or reverse diseases. Now, this diagnosis is usually seen in younger men. That's testicular cancer. Young men age 15 to age 35, and then there's a second increase in older men from 55 and above. It is believed that approximately 90% of testicular cancer will occur in men under the age of 55. As I mentioned, testicular cancer is seen mostly in younger men. Now, what are the risk factors for testicular cancer? Well, let's go over some of the risk factors. 1, age, younger men, and then a second increase in men over 55. Next would be race. Caucasian men have a 5 times greater risk of developing testicular cancer than black men, and 3 times greater risk than Asian men. The Hispanic men will fall in between there. Testicular cancer is believed to occur more in the United States than in other parts of the world. And it is believed that if you have a family history of testicular cancer, then your risk will increase by 3%. So that is, if there's a brother or a father with testicular cancer, then your risk will be increased, the same as breast cancer, as we mentioned a couple of weeks ago. That if there's a first-degree relative with breast cancer, then the woman has an increased risk for breast cancer. Now, men and boys, the same thing with you. So if you have a family member with breast cancer, then you have to think about this disease and how you're going to prevent yourself from getting the disease or detecting the disease early. Now, there are other conditions that will increase the risk of breast cancer. Now, there's a condition that is known as undescended testicles. You know, during the development of the child in utero, the testes are formed in the abdominal cavity. But before the child is born, then the testicles are descended into the scrotal sac. Now, in some cases, 3% of male will be born with the testes still in the abdominal cavity. This is called cryptorchidism. Now, patients who are born with the testicles still in the abdominal cavity have a high incidence of developing testicular cancer. And now, what about infection? Now, research has shown that men who have had HIV infection, who have HIV infection, have an increased risk of developing testicular cancer. So how do you protect yourself, men? You have to be very careful that you do not expose yourself to the HIV virus. Suppressing the immune system will cause anything to grow, not only testicular cancer, but other cancer. Now, there's another cancer that is called carcinoma in situ that is also seen in the testicles. This cancer doesn't present with a mass. It's usually found when the testicles, when there's a biopsy of the testicle for other conditions like infertility. Now, there's not, equal consensus as to how to treat the carcinoma in situ. Some doctors believe you can watch and wait, and other doctor will take another intervention. Now, before we continue with testicular cancer, I think we should go into the anatomy of the testicle. So you men, you can visualize exactly what I'm saying. So this time I'm going to have you look at a picture, a diagram of a normal testicle. And we're going to talk a little bit about the parts there. So there you can see a healthy testicle, and you see the testicle there at the bottom, and you also see on top of the testicle the epididymis. The epididymis stores the sperm that are produced in the testicle. Then the vas deferens, that's the tube that takes the sperm during ejaculation up through the seminal vesicles into the prostate and out through the penis. Now on the other side, you can see the same structure, but you notice the testicle is not as smooth. The formation is somewhat different. We have tumor formation. Now, as we continue with this presentation, you will see why there is that irregularity in the testicles and how you need to detect this irregularity. Now, I have Dr. Dave. Dr. Dave is a urologist, and he has some information on testicular cancer. So we're going to continue with information from Dr. Dave, a urologist, So men, you can understand what I'm talking about. So let's show one of the first video from Dr. Dave, so that our audience can understand a little bit more about testicular cancer.
Testicular cancer is a cancer that affects approximately 1 in 250 men in the span of their lifetime, with an incidence of about 0.4%. Notably, it affects most commonly men in their between 20 and 40. So of all cancers that affect men between the ages of 20 and 40, testicular cancer is the most common one. When we talk about how common it is, we talk about something called a bimodal distribution, which means that there's two spikes of peak incidence, and one spike occurs between 20 and 40, another spike occurs around the age of 60. And men who get testicular cancer at the age of 60 tend to have a type of cancer called spermatocytic seminoma. Testicular cancer, as any other cancer, is basically an abnormal or uncontrolled growth of cells within the testicle. And when some of those cells grow uncontrollably and have the ability to both invade and spread to other parts of the body, we refer to that as testicular cancer. Of the various types of testicular cancer, cancers can arise from cells within the testicle where sperm is produced, or there are other types of cells in an area called the interstitium, where they have certain cell types called Leydig cells and Sertoli cells. Leydig cells actually are responsible for testosterone production. You can get tumors of the Leydig cells. They're called Leydig cell tumors. You can get tumors of the Sertoli cells. Leydig and Sertoli cell tumors are one type, but they actually represent the minority of testicular cancers, approximately 5% or less. 95% of testicular cancers arise from the sperm-producing cells, what we call the germ cell tumors. Of germ cell tumors, there are also many different types. However, we broadly classify them into two broad categories, one type being seminoma and the second type being non-seminoma. Now, non-seminoma can have multiple subtypes within that group, and those include things like embryonal cell carcinoma, teratoma, choriocarcinoma, and yolk sac tumor. These are all types of testicular cancer. There are other cancers that can affect the testicle as well. And these may be things such as lymphoma, which can involve other parts of the body and actually grow within the testicle itself. There are some more rare types of very aggressive cancers that can affect the testicles, such as rhabdomyosarcoma, sarcomas, and these are very aggressive forms of cancer. They don't necessarily originate within the testicle. However, there are also some benign conditions that affect the testicle that can often be confused for testicular cancer. And there are tumors that arise in the tissues around the testicles that can be benign as well. But in general, when we refer to testicular cancer, we are talking about cancers that arise from the testicles. The most common types we talk about, as I mentioned before, 95% are what we call germ cell tumors, with seminoma and non-seminoma. The reason we categorize, we put cancers into these separate broad categories, seminoma versus non-seminoma, it really affects the way we manage the cancer, we treat the cancer. There are different algorithms and different pathways we use when evaluating, diagnosing, and treating patients with these different types of cancers.
Thank you, Dr. Dave, for that information. Men, don't be confused. There are different types of testicular cancer, but most importantly, you need to be empowered to know when you think you need to see the doctor. So let's look at some of the symptoms of testicular cancer. Now, one of the common symptoms is to have a painless lump on the testicle. So men, you need to check your testicle every month. As we continue the program, I'll discuss the correct way to palpate the testicle. Now, apart from a non-tender lump, you could also have enlargement of the testicle. The testicle might be bigger in size or might be swollen. That's one sign. There might be testicular pain and tenderness. There might be fullness and pain in the pelvic area. These could indicate that you might be having testicular cancer. However, these same symptoms could mean benign pathology of the testicles, which we will discuss later. Now, breast growth and soreness could also indicate testicular cancer, because the testicles could produce hormones that will stimulate the growth of the breast. All right? Now, another important signs, mothers and young boys, that you have to look for is early signs of puberty in the younger boys. Boys start having deepening of the voice and facial hair because they might have testicular cancer that's producing a large amount of testosterone. So these are signs and symptoms that you need to be aware of in order to diagnose testicular cancer early and to get early intervention. Now, there are other signs and symptoms that may indicate that the cancer has now left the testicles and have gone outside of that area. For example, low back pain. Low back pain could indicate that the testicular cancers are in the lymph node in the pelvic area. Shortness of breath, chest pain, difficulty breathing, a chronic cough. This could mean that the cancer has spread from the testicle and now it's in the lungs. Abdominal pain, belly pain could indicate that the cancer has gone into the pelvic area, the abdominal area. And what about headache and confusion? This is a very common sign when the cancer is now spread to the brain, has metastasized to the brain. So these are signs and symptoms. So you have very benign signs like just a non-tender lump in the testicles, to heaviness in the abdominal area, to breast enlargement, breast tenderness, to back pain, to shortness of breath, and to confusion. These are signs and symptoms. I'm going to let Dr. Dave also emphasize some signs and symptoms of testicular cancer. So let's listen to him again in another video. Dr. Dave.
Most commonly, testicular cancer usually presents with a mass that appears within the testicle. There may be things that occur that draw the patient's attention to that mass. For example, pain or discomfort in the groin area, or trauma. Sometimes people have trauma to the area and all of a sudden it draws attention to the area and they examine themselves, or someone examines that area and they feel a firm, solid mass within the testicle. That is a classic appearance of testicular cancer. Until proven otherwise, any solid, firm mass within the testicle should be considered as a potential cancer. Although there are other things that can cause similar findings, that's one of the more common presentations. Testicular cancer can spread to other parts of the body, including the abdominal area, the chest, and various other areas. And when it does do that, then patients may notice symptoms due to the spread of cancer to those sites. For example, when cancer spreads to the lungs, patients may have shortness of breath or difficulty breathing. Cancer can spread through the lymphatic channels to lymph nodes in the body, and so sometimes if there's extensive spread, patients may feel lumps in the neck area or the groin area, various other parts of the body that may signify the presence of cancer. But in general, most of cases of testicular cancer will also have some form of a mass within the testicle itself. It's not always a 100% guarantee, but most commonly that's the way it presents.
All right, men, you heard that from the urologist himself. So make sure, as I say, on a monthly basis, you're checking your testicles. All right, now there are other benign conditions that will affect the testicle that I need to mention to you, because many times a young man might come into the office very anxious that he probably has testicular cancer when he has various benign conditions. One of the most common conditions I see of the testicle is severe acute onset testicular pain. That is a torsion of the testicle. Now remember, the testicle is like a golf ball and it hangs down in the scrotum. To the testicles, we have blood vessels coming. Now, sometimes the testicle could just turn on its axis, compromising the blood flow. That is a medical emergency. It's called torsion. How do we diagnose? The patient should be sent immediately for a stat sonogram. The sonogram will indicate whether or not the testicle is getting enough blood flow. Now, if we diagnose torsion, then the patient needs to have emergent surgery, or else the blood flow will be cut off from the testicle will die, and that patient will lose the testicle. So men, if you have sudden onset of severe testicular pain with redness or swelling, then you must see your doctor immediately. If you stay in that situation for several hours, then you will lose your testicle. Now, there's sometimes the patient might come in with pain to the testicle, but not severe because of some injury. It could have been riding a bike or involvement in sports, and the testicle might have some blood around there. It will cause swelling and pain. That is not a medical emergency, but we should also obtain, as medical providers, a sonogram to ensure that the circulation to the testicle is intact. Now, some patients will have also severe pain from infection, but usually if the testicular pain is from infection, we probably will call that epididymitis or orchitis. It means that the patient has a bacterial infection, which could be sexually transmitted. Sometimes patient might have pain on urination. They might have a clouded discharge. They might have fever. On examination, when the doctor examines the patient, the testicle will be tender, and a lot of time we will try to elicit penile discharge. If there is penile discharge, we then know that this is an infection. Patient will need antibiotic. Now, there is another condition that is called hydrocele. Hydrocele is when there's a collection of fluid behind the testicles in the scrotum. Now, that condition is benign. It's diagnosed using a sonogram again to check for fluid collection. That is benign. If the fluid continues to collect, then the patient needs to have surgery. There's another condition called varicocele. Varicose veins are just enlarged veins that's in the testicles. You can feel that through the scrotal sac. That is not cancerous. It is described as a bag of worms. So men, when you're trying to palpate your testicles, if you feel a bag of worm and you're not sure, just go into the doctor for the doctor to confirm that this is not testicular cancer. The other very common pathology that we find with the testicle is a hiatal hernia. You know, the hernia is formed because of a weakness in the wall, in the muscle wall, and therefore the intestinal sac will move down into the scrotum, will cause a enlarged scrotum, and this will appear as a mass. This is a very benign situation, and if the hernia continues to grow or if it's very large, then the patient needs a hernia repair. Now, kidney stone. You know, kidney stone can cause pain in the groin that will reflect down into the scrotum. That is very, very painful, but it's not a cancerous condition. We treat that conservatively, depending on the size of the stone and all the other complications, maybe with hydration, antibiotic, and surgery depending. So we discussed torsion. That is an emergency, and you need to be aware of that situation. All right? Now, as we continue to discuss testicular cancer, Dr. Dave has another video, because now, how do we treat testicular cancer? Testicular cancer is treated with various methods like any other cancer. One is to remove the testicle, the other is chemotherapy, and the other is radiation therapy. So men, you might be wondering, okay, so if I have testicular cancer, what are my chances to have children? Or what will happen to my sexuality? Will I lose all of that? So I'm going to let Dr. Dave discuss the consequences, the side effect, the complications that you will have from testicular cancer treatment. Let's listen to Dr. Dave.
So often when patients present with testicular cancer, because the testicles are involved, patients are often concerned about their ability to have sexual performance either during treatments or after treatments. Now, there can be several potential impacts on sexual function as a result of some of the therapies that we have for testicular cancer. Certainly, we discussed the possibility of infertility due to some of the treatments we have, because that can affect the sperm. And for that reason, we recommend that patients bank their sperm ahead of time. Patients are sometimes concerned about their ability to have erections or sexual activity. Now, treatments for testicular cancer, whether it's chemotherapy or radiation therapy, generally will not affect the ability for a man to have an erection. Now, if in rare cases where testicular cancer occurs in one testicle and may then reoccur in another testicle, then both testicles sometimes have to be removed in very rare cases. In those cases, then the patient loses the ability to produce testosterone. Testosterone is normally produced by the testicles and provides what's called the libido, or the desire for sexual activity. Even though there may be removal of the testicles, we can actually supplement the patient's testosterone by administering testosterone, what we call exogenous testosterone or testosterone replacement therapy. So we can then give the patient testosterone to give that patient the benefits of the testosterone, including getting their desire and libido back to normal. But certainly effects on testosterone can affect your libido. Another way that sexual activity may be affected is through something called retrograde ejaculation. In some cases where testicular cancer has spread to the abdominal lymph nodes, or where a procedure is done to remove the lymph nodes in the abdominal area, there can be damage or injury to some of the nerves that go through that area. These nerves are called sympathetic nerves, and they go down to the pelvic area and allow a man to be able to ejaculate properly, which means that during the course of ejaculation, semen is expelled through the urethra. With retrograde ejaculation, what occurs is that ejaculation still occurs, but rather than coming out the front, it actually goes backwards into the bladder. So when there is injury to the sympathetic nerves during this procedure called the retroperitoneal lymph node dissection, then that can, in some cases, cause retrograde ejaculation. So that can be something that changes during sexual activity. So yes, testis cancer can affect sexual activity in some way or shape or form, but in most cases, the ability to have erections will be sustained, and none of our treatments generally affect the ability to have erections.
Thank you, Dr. Dave from howcast.com. So if you want more information on testicular cancer, then you can go to Dr. Dave at howcast.com. Now, men and wives and mothers and sisters and brothers, listen, the most important thing that we can do to prevent yourselves from getting cancer is to protect ourselves from getting cancer as lifestyle modification. And even though we are not quite sure of some of the etiologies for testicular cancer, we do know that we can tweak our genes with healthy lifestyle. Studies have shown that cancer cells grow slower in the blood of plant-based patients. So consuming fruits and vegetables, nuts and seeds, we discussed that last week, will increase your immune system. You will ingest a lot of anti-cancerous chemicals, which could help to retard the growth of these cancers. So as you continue to watch, you need to remember that there's certain animal products like saturated fats, red meats, processed meat. As a matter of fact, processed meat is now classified as a class 1 carcinogen. So men, if you're consuming, or women, or my listeners, if you're consuming processed meats and saturated fats, you need to consider changing your lifestyle. And I have made it quite easy for you. I have 3 books on the market. One is Get Healthy for Life, in which I outline 9 secret pillars of health. Then the other book is 14 Days to Amazing Health. This book has over 100 plant-based recipes that you can follow. The book also outlines methods to manage your stress. The book outlines various exercise programs. And then the last book is Incredibly Delicious Vegan. In that book, I have organized meal plans, shopping lists for 28 days. So I've made it easy. You can also go to my website, drdonacooper.com, and you'll have a lot of resources to maintain good health. Now, men, you might be wondering, all right, so now I've heard about the basic information in testicular cancer. How do I check if I have any tumors? Now, it is recommended that men, you palpate your testicles once per month. It's best if you palpate your testicle during when you're taking a bath. At that time, the scrotum will be more relaxed and you'll be able to palpate for any tumoration that might be there. Now, how do you do that? So you remove the penis out of the way, then you hold the testicles between your thumb and your fingers, and you gentle roll, you gentle palpate. You're palpating, looking for the texture of the testicle, as well as looking for tumoration or lumps or bumps. Now you need to keep in mind that at the back of on top of the testicle, you will find the epididymis, and that is the little, it could be palpated as a mass, but that's not a mass. Now, if you're not sure what you're palpating, then you need to go in and talk to your provider. Now, it is not unusual for you to have one testicle that is larger than the other one, and one testicle that might be lower than the other one. But remember, I discussed that if the testicle remains in the abdominal wall, then the risk of cancer is 6 times. So mothers, if you're listening, you need to ensure that your child is checked carefully to ensure that both scrotal sac contain testicles. If the testicles are not there, then the testicle can be descended surgically to decrease the risk of testicular cancer. If you're still not sure, make sure that you take the child in to see the healthcare provider. This is very important. Even though testicular cancer is not very common, when it's seen in the younger boys, it's usually the more aggressive type. So you want to ensure that your child is not at risk for this cancer. Many times the young boys will come into the office and they're a little bashful and they don't want to be examined. But healthcare providers, if you're listening, or parents, or young men, or fathers, please ensure that that child is examined at least once yearly. And then you older men, make sure that you're checking your testicles carefully. Using your thumb, using your finger, you roll the testicle and check for the shape, and check for the size, and check for any tumoration or any lumps that you might find. Now, as I mentioned before, in order to maintain a healthy lifestyle, you need to eat healthily. You also need to exercise. So in the program today, I have included a video on exercise, because exercise is medicine. There are many health benefits right now on exercise. One is that exercise will help to decrease your weight. Remember, we discussed that obesity will increase the insulin in the blood because obesity can cause insulin resistance. A high level of insulin will cause insulin-like growth factor level to be high. Insulin-like growth factor can lead to tumor formation, cancer formation. So if you want to suppress any form of cancer, whether testicular, prostate, breast, endometrial, it's best to maintain a healthy weight. Now, one of the best exercises you can do at home is brisk walking. Walking 30 minutes, 45 minutes a day, brisk walking. But if you have no time to go out and walk, if it might be cold now in the winter, then there are different types of exercise you can do in the comfort of your home. So watch this video and try this week. In maintaining a healthy weight, physical activity is very important. So at this time, I'm going to send you over to Rebecca and Christopher in the Living Active segment.
Thank you, Dr. Cooper. This is Living Active. My name is Rebecca Huerta. This is Christopher Hanna, and we're going to be demonstrating some at-home exercises that you can do in the comfort of your own home. Today we'll be focusing on the core because the core is very important that you build strength in here because you use your core for everything that you do. Any exercise that you do, you will be engaging your core at some moment or the other. So the first exercise we're going to demonstrate is called the 100. What it is that you're going to go ahead and lay straight on your back. You're going to lift your legs and your head a little bit. You're going to put your legs into what you call a tabletop position. You're going to keep your core tight. You're going to inhale for 5 seconds, and you're going to splash like if you're splashing some water. And you're going to inhale for 5 seconds, and then you're going to exhale for 5 seconds. And you'll repeat this until you get to 100 seconds. The next exercise we're going to demonstrate is going to be called the crisscross. The crisscross is similar to a version called the bicycles. But what you're going to do is every rep that you do, you're going to make sure that it's slow and controlled. You're going to bring your elbow to your knee while leaving the other side straight on the floor. And you're going to want to repeat this for about 3 to 4 sets of 15 to 20 reps. The next exercise we're going to do is called the corkscrew. You're going to lift your legs straight and you're going to go into one direction making a big D. And then you're going to go to the other direction making another D but backwards D. And you're going to want to make sure that you always keep your core nice and tight and make sure you keep breathing, inhaling, exhaling. Don't hold your breath. The fourth exercise we're going to go ahead and demonstrate is going to be called the single leg lift. You're also going to make some Ds. You're going to do a circle, one direction for 5 reps, and with the same leg, you're going to go the opposite direction. And then you're going to switch to your other leg. And you're going to do Ds to one side and then Ds to the other side. The fifth exercise we're going to demonstrate is called the double leg lift. You're going to put your legs together and you're going to go ahead and go up and down. If you want to make it a little bit more challenging, make sure that your feet are not touching, that you have a little bit of space in between while you lift your legs. And you want to make sure again that you keep your core nice and tight. And it's very important that you drink plenty of water, you stay hydrated, you take rest when needed, but also remember to challenge yourself. And this is Living Active. Now back to Dr. Cooper.
All right, guys, that's a very simple routine that you can do right there in your home. So if you're living in areas where it's cold and you don't want to walk, just do something at home. 30 minutes is recommended for at least 6 days a week, or 45 minutes for 5 days a week. Now, I'm going to take the time to welcome some of our friends that are on Facebook. I see Pauline Wells from the Bahamas, my cousin. Well, welcome for joining us. I'm also going to welcome Loida, Freddie, Donald, Rosalinda, Barry, or Bree, Diane, Dr. Diane A. Thompson, that I met recently. She's also a lifestyle medicine doctor. Welcome, Diane. Wendy, my wonderful patient, Mrs. Carnes. I saw her this week, you know. I'm going to go off tangent here. Well, let me not say anything, but welcome, Mrs. Carnes. Sonny, I want to welcome you as well. Now, if you just join us, we're talking about testicular cancer. Testicular cancer, though it's not very common, it occurs in 1 in 260 men in the United States. It is more common in Caucasian men, 5 times more than black men. It is also common in patients who have undescended testicles. It's common in men with HIV. How do you detect yourself? Well, some of the symptoms, a non-tender mass in the testicle, and I'm sure you all know where the testicle is. Testicular pain could be a sign or symptoms. Abdominal pain, abdominal fullness. If the cancer has gone from the testicles into different parts of the brain, we say the cancer has metastasized. Then there could be shortness of breath, chest pain. There could be headache or confusion, abdominal pain if it's in the liver. It is good to empower a patient. The reason why I have this program is to empower. You know, many of us as physicians, we're in the office and you come in with a problem and we make a diagnosis and we treat. But it is also very important for us to educate so both the physician and the patient can work together as a team to prevent diseases. Now, the C word is something that scares everybody. No one wants to have any form of cancer. So therefore, we as physicians need to empower you. What steps can you take to empower yourself, to improve your likelihood of not getting the cancer? We all know that our lifestyle, what we eat, the toxic chemicals that we are exposed to, can put us at a greater risk for various types of cancer. So I'd like you to take this information, share it with your friends. If you have questions, write your questions. I'm looking here on my phone and I'm not seeing any questions. But send me questions and I'll do my best to research and to return with the correct answer. Now, as I said earlier on in the program or last week, that the month of November I would emphasize Men's Health Month. But I also want to add in diabetes. So maybe next week I will be talking about diabetes. Diabetes is a disease that can affect so many different organs in the body. And the month of November is also Diabetes Awareness Month. So next week, I'm going to be discussing diabetes and how diabetes affects the men. Erectile dysfunction. That's a very common problem in young men with diabetes. How can you prevent yourself from getting erectile dysfunction? Because now the erectile dysfunction not only affects one person, but it also affects the spouse. So we'll be discussing diabetes and erectile dysfunction next week. So I want you to share the information you're learning today. Have your friends tune in so that they too can be empowered to take charge of their health. And together we can change healthcare outcomes. Now, we're talking about lifestyle. And one of the most difficult things for anyone to do is to change what they eat. You know, I always tell my patients, it's very difficult. I know. Having followed a particular diet for 20 years, 50 years, and now you're told that it's best to change what you're eating to something else. It's a challenge. We celebrate with food. If we have a wedding or a birth, even death, we come together and we celebrate with food. But as I mention always, food can either be your medicine or food can be disease causing. So we have to be very intentional on what we put on our plate, because what we put on our plate could be killing us or curing us. Now, I know we're in our festive seasons. We're coming around to Thanksgiving, and you might be wondering, okay, Dr. Cooper, so if I'm not going to eat my turkey and my ham because ham is processed and it can be pre-cancer causing, then what am I going to eat? Now, for me, I eat a very simple diet, you know, plant-based for many years. So in this segment, I am going to be demonstrating to you a very simple meatball, meatless ball that is wholesome, filled with good fats, good protein that you can prepare at home during this festive season. Let's go to our cooking segment. We're back in the kitchen today with Maribel. What are we preparing today, Maribel?
We're going to make some walnut balls. And these are wonderful for now the holidays. It's a great opportunity to be able to share such a great recipe with your family and whoever you're going to be having over.
Right, so these are walnut meatless meatballs.
Meatless meatballs, that's
Are
correct.
they very tasty?
Awesome. My patients loved it. We prepared them all week.
Excellent. Well, why don't you go ahead?
Well, what we want to do is, first of all, let you know everything's going to happen within our pot. So we went ahead and you can either put 4 cups of vegetable broth or 4 cups of water and just bring everything to a boil, which we pretty much are at. Let me get rid of this and do it afterwards. We're going to start adding all our ingredients. We have 1 cup of walnuts.
Very good.
Sorry.
And you know, walnuts are high in protein.
And omega-3s, yes.
Okay.
And we're going to add half a cup of unsalted, untoasted. Those are the raw sunflower seeds.
Excellent.
Just add it, and we're going to put a whole onion, chopped onion. So we added our onion, and it's boiling.
Next.
We're going to go ahead and proceed by adding half a cup of vegetable or olive oil.
And you can cut back on that. It doesn't have to be half a cup. It could be a quarter cup. Yes.
We're going to do our raw garlic or garlic powder.
And you know, garlic is very good for the immune system, so feel free to put extra garlic there.
That is correct. We're going to put 1/4 cup of yeast flakes.
And this is nutritional yeast, which is filled with vitamin B12.
1 teaspoon of our coriander.
Very nice.
1 teaspoon of our sage. 1 tablespoon of our Italian blend. Just get it all in there.
Very good.
And we're going to put a tablespoon of molasses. You can put them dry, or you can also find them in the bottle.
The liquid.
The liquid.
Very good.
Bring everything to a boil. And the last ingredient that we're going to add are 4 cups of old-fashioned rolled oats.
And you know, rolled oats, this is filled with protein. For 1 cup of oats, you have 29 grams of protein. So don't be hesitant. This is filled with a lot of protein.
And all you're going to do is mix a little bit, remove from the stove, and leave it covered for 30 minutes.
Very good.
After 30 minutes, we start.
Are we going to add that?
I'm sorry, yes. We're going to add our half a cup of soy sauce. Thank you, doctor.
Very nice.
Go ahead and add our half a cup.
And that gives it the extra flavor, as well as some, if you use the, not soy sauce, but the amino acid.
Amino-Rex.
Yes.
Amino-Rex, yes.
Then you're getting extra amino acid, the building block for protein.
And we're going to go ahead and show you the prepared or the cooked, and we'll go ahead and start making our
Meatballs.
Meatballs.
Okay, go ahead.
We're going to go ahead and use our slightly oiled cookie sheet, and I have found very helpful to use my tablespoon measurement, and that gives you the exact size that they will all come out to.
But of course, if you want to make bigger
balls or hamburgers,
you can make them in a larger size, of course.
That is correct. We're going to be cooking these meatballs for 20 minutes on each side.
Very nice.
You go ahead and press them, and like doctor says, we can make them bigger, or you can even make, there we go.
Very nice. And you know, Maribel, I like to do this when I'm having guests.
Yes.
And my guests, some of them are not vegetarian, but when they eat these balls, they taste exactly like meat. All right, go ahead.
That is correct. And this morning we cooked them for our patients, and what I did was I served them as hors d'oeuvres, and just have them try both. With marinara sauce is a good suggestion, whether you have the spaghetti or just the hors d'oeuvre, and with barbecue sauce.
Very good. Do you have some prepared already,
Yes, I
Maribel?
do.
Why don't we bring those out?
Yes, ma'am.
All right.
So we're going to cook these balls, don't forget, 20 minutes on each side.
20 minutes on each side. So we have some prepared for you. So if you have children and you want to do this with spaghetti, then you have it right there. It's very delicious. Or you can have the barbecue one. I love this. But if you're diabetic, then try not to use a barbecue. Go with the marinara sauce. Maribel, I think this looks delicious.
I think it is, doctor, and most of our patients, well, we had a vote, and there was a split. Some of them really liked it, and like I said, I served them with just the sauce, and they loved them. So go ahead and surprise your guest on this holidays.
Very good. So for more recipe, go to our website, www.gethealthywithdrcooper.tv. Thank you, Maribel.
You're welcome, doctor.
Thank you again, Maribel. Guys, this is a very, very delicious recipe. You can actually fool your guests with this recipe. So try this over the holidays. You can make meatballs. You can make patties. You can also make mini, what do we call it? Mini pies. So you put the filling in these mini pie cups and you bake them. Beautiful, wonderful hors d'oeuvres. So try this, send me a message and let me know how you like this. My kids love this. My guests usually like this. As a matter of fact, one Christmas I had my staff at home for Christmas party. And we went plant-based all the way. And my guests were just consuming these balls, thinking they were meat, even though they know it wouldn't be meat because Dr. Cooper wouldn't have meat. But these are delicious. Try these balls over the holidays. Let me take some time to welcome my wonderful classmate, Dr. Hub Cortez from Mexico. I see you here. Bienvenido, Hub. Hay que regresar la semana que entra, Hub. I want to welcome our other friends, Mr. Freddie Peralta. My daughter is online there, and I have several patients. My cousin out of the country, Mrs. Daly, welcome. Keep watching us. As you know, that the emphasis is not to treat diseases, but to get to the root cause and to empower you to take care of your health and therefore live a happy, longer, and healthier life. So follow us on all our social media platform and learn how you can use food as medicine. Many years ago, Hippocrates wrote that let your food be your medicine and your medicine be food. Nowadays, scientists have discovered that the #1 risk factor for diseases, whether chronic diseases or cancer, it's actually improper food, improper dietary choices. The food that we consume could either be killing us or be curing us. So be very intentional as to what you put on your plate. Make sure you take your time to think Prepare your meals. I know it's very difficult, especially if you're busy, to prepare your meals, but do that maybe twice a week. On the weekend, shop and do some preparation, and then another day during the week, do some more preparation. Take at least one healthy meal to work. That will inhibit your desire to go and get something unhealthy. And make sure that you're timing your meals properly. Eat a great healthy breakfast in the morning, a good meal during the day, and a smaller meal at supper. Because if you consume a large meal just before you go to bed, then you're going to have many problems. Poor quality sleep, indigestion. You might be gaining weight because you don't have time to burn up the calories. So make sure that you're learning how to take care of yourself. And as you learn, share the information, because together we can create a healthier world. And do you know what? Our Creator, God the Father, the great physician, He wants us to have good health. He said so in His Word. So I want you to realize that your body is really the temple of God and the Holy Spirit. So why should you put poor quality food in your body? Why should you make yourself ill? So take care of your body this week as we journey together to a longer, happier, and more fulfilling life. And for you that are living in Miami, remember I'll be in Miami this Sunday at the Miami-Dade College for my first book signing event. I am totally excited. I'll have all 3 books there and promoting 14 Days to Amazing Health. If you have not gotten that book, get yourself a copy. I had a patient who came to me after she read the book. She said, Dr. Cooper, the first time I joined your program, I joined for my husband. But now I've read the book and I really want to change my lifestyle. And she's following the steps. The book, 14 Days to Amazing Health, is like you have your own personal physician at your bedside. Your health coach, everything is compact in that book, giving you step-by-step information how to change lifestyle and how to take charge of your health so you can live a longer, happy, and a more abundant life. Until next week, I'll see you same time, same station. Spread the message to your health.